Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 compression fractures occur every year in the spine. Most of these are from osteoporosis, and a lot of them actually go unnoticed because they don't have any pain. 50% of women and 25% of men will sustain an osteoporotic fracture during life, and once a compression fracture occurs, the risk of additional fractures in the vertebrae above or below increases fivefold. Typical symptoms of a vertebral compression fracture include sudden onset of back pain that gets worse while standing or walking, limited spinal mobility, and potentially height loss, deformity where you're leaning forward, and disability. Here's a typical downward spiral. You start to have these spinal compression fractures, which leads to back pain, leaning forward with multiple fractures, so you have this deformity, and then it pushes on the lungs, so decreased lung capacity, decreased lung function, loss of appetite because it's pushing on the stomach, sleeping problems because of the pain, decreased activity because of the pain, and then you get more bone loss and osteoporosis, which increases your fracture risk, increased lung problems, comorbidities, and then end result is a 23% increase in mortality. Well, treatment options. The first option is if it's not that bad, you can sort of neglect it and watch it. Okay. Medication management may include over-the-counter pain medications such as anti-inflammatories and Tylenol. Narcotics can be very helpful, muscle relaxers as well. Spinal bracing, such as you see here. This is called a Jewett brace. It actually compresses on 3 levels, 3 areas, here in the chest, abdomen, and then the back. The vertebroplasty procedure was invented in the 1980s for treatment of fractures due to cancer. Eventually it crossed over into regular osteoporotic fractures. It's an outpatient, low-risk procedure that provides instant pain relief. What the pain doctor will do is put a catheter across this bone called the pedicle into the vertebral fracture. Okay? And once the placement is satisfactory, cement is injected to provide an internal splint, effectively, or internal cast for the fracture and provide instant pain relief. The kyphoplasty procedure is an evolution of that procedure. It was FDA cleared back in 1998. The popularity increased tremendously 5 years later. It's similar to a vertebroplasty that's using bone cement to provide that internal cast, but what you're doing first is you're inflating a balloon to create a bony void. So here's the treatment outline. The tools are inserted into the fractured vertebral body, such as you see here. Then the balloon's inflated, which can help to increase height and also create this nice bony void. It's deflated and taken out, and then bone cement is slowly, under low pressure, inserted into the bony void. And you can see it just finishing there. What are the outcomes? Well, typically a patient gets immediate pain relief from the stabilization. The aches and spasms may continue for a few weeks, but most resolves right away. Over 90% of patients see dramatic relief immediately with significant increased function, such as walking and performing activities of daily living. There have been some studies showing questionable benefit. They are far outnumbered by the ones showing significant pain relief, and there are a lot of questions about how those studies were performed. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state, over 10 in fact, that accept over 50 insurances and provide over 25 treatment options with the board-certified doctors. Visit us today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.